Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of obstructive azoospermia. If there is obstructive azoospermia, that means sperms are present in the testis and the epididymis. So, if the sperms are present in the testis or epididymis, the testis is if the sperm is present in testis, then we can do testicular sperm aspiration or testicular sperm extraction can be done. So for epididymis, for the sperms present in the epididymis, we can do percutaneous epididymal sperm aspiration or microsurgical epididymal sperm aspiration can be done. Now with these four techniques, you will get the sperm. Now this sperm is injected intracytoplasmically into the ovum. So that is called as intracytoplasmic sperm injection is done.
thank you and thank you for watching.